Is ibuprofen killing you? Hi, this is Dr. Jason West, and this video is about ibuprofen or NSAIDs. Let's review what is ibuprofen, how does ibuprofen work, and what's the difference between ibuprofen, aspirins, and an NSAID, and is there anything natural that helps with pain? Now please like the page or video and also drop us a comment if you're curious about a healthcare concern or condition. Just ask about it and I'll try to make an information video about it or put it in our live cast. So let's talk about ibuprofen. Ibuprofen is classified as an over-the-counter medicine or drugs that you can buy without a prescription. Now that makes everybody think that they're safe, but they do have some effects. Some over-the-counter medicines relieve aches and pains and itches, and some prevent or cure disease like tooth decay and athlete's foot. And others help manage recurring problems like migraine headaches. In the United States, the Food and Drug Administration decides whether medicine is safe enough to sell over-the-counter. And taking an over-the-counter medicine still has some risks. Some interact with other medicines or supplements or foods or sometimes even what you're drinking. And others cause problems for people with certain medical conditions. If you're pregnant, talk to your healthcare provider before taking any over-the-counter medicine. Now, it's important to take medicines correctly and be careful when giving them to children. More medicine does not necessarily mean better. You should never take an over-the-counter medicine longer and higher doses than the label recommends. And if your symptoms don't go away, it's a clear sign that it's time to see your healthcare provider. Now, there's some really common over-the-counter medicines: Nicorette gum, Zyrtec, Trioxyl, Tylenol, aspirin, Aleve, and acetaminophen. So let's talk about ibuprofen. It's a medicine, a non-steroidal anti-inflammatory drug that's used for treating pain and fever and inflammation. And this includes like painful menstrual periods, migraine headaches, and even rheumatoid arthritis. About 60% of people improve with any given NSAID, but it's not always long-term, and it's recommended that it does not work, then another should be tried. It also may be used to close a patent ductal arteriosus in a premature baby, so there's definitely some medical uses for it, and sometimes it can be used by mouth or intravenously, and it can work very quickly. Now, some of the side effects include heartburn, a rash, and compared to other NSAIDs, it may have fewer side effects such as GI bleeding, which is common in aspirin, or it increases the risk of heart failure and kidney failure and liver failure. So there's usually a price tag in taking over-the-counter medicines, and at low doses, it doesn't seem to have the effects of the heart attack risk factors. Ibuprofen can also worsen asthma. While it's unclear if it is safe in early pregnancy, it appears to be harmful in later pregnancy and therefore is not recommended. And like other NSAIDs, it works by inhibiting the production of a chemical called prostaglandins by decreasing the activity of the enzyme cyclooxygenase. Man, that is a mouthful. I had to practice a lot for that. Ibuprofen might be a weaker anti-inflammatory than other NSAIDs, and it was discovered in 1961 by Stuart Adams and John Nicholson and marketed as Brofen. It's available under a number of different trade names, including Advil and Motrin, and it was first marketed in 1969 in the United States and in 1974 in the United Kingdom. It's on the World Health Organization's list of essential medicines, the most effective and safe medicines needed in the healthcare system. And it's available as a generic. The wholesale cost in the developing world is really cheap, literally about 5 cents per dose. So what's the difference between ibuprofen and aspirin and NSAIDs? Aspirin is pretty rough on the GI system and it's really not safe for kids. Ibuprofen is less hard on the stomach. And then naproxen is an anti-inflammatory agent, more linked to arthritis. And Tylenol or acetaminophen is usually for headaches and fevers, not so much arthritis. Now, if you're looking for some natural pain management considerations, here's what I would recommend. Number one, make sure that your blood sugar is stabilized. This is such a trigger factor for headaches and for pain. Also, increasing your water intake. Water is it's just not given the credit that it deserves. It's literally an essential nutrient. And then watch your inflammatory foods like white sugar and artificial sweeteners. And there are some natural non-steroidal anti-inflammatories that I'm excited to share you about. One, high-dose essential fatty acids, which is omega-3s and 7s and 9s. If you mix those with the proteolytic enzyme like marcozyme or pineapple or papaya or even cherries, it has a really nice anti-inflammatory effect It doesn't work as fast as ibuprofen, but in the long term, what happens is it spares your liver and your kidneys and doesn't give you a heart risk factor. The other thing that's really important for natural painkillers is vitamin D3, curcumin, turmeric, even high-dose B vitamins work really well. Now, if there's anything that we can do to help any of the risk factors associated with over-the-counter medicines by reducing anti-inflammatory foods and sugar, increasing water take, getting more vitamin D3 are really effective. Now, there's some in-office treatments that work really well in lieu of a non-steroidal anti-inflammatory. Physical touch medicine, massage therapy, physical therapy, chiropractic adjustments, acupuncture, pulsed electromagnetic frequency therapy, and my favorite one is the regenerative injection therapy of neural therapy, which, don't worry, we've got other videos about it, but a real quick recap on neural therapy is we take a B vitamin, a little syringe, a tiny dental needle, and we basically do little tiny mosquito bite type acupuncture injections into the acupuncture points. It makes the nerves open, close, and reset. So what am I trying to summarize? Summarize that no one wants to live in pain. I don't want to live in pain. I have patients that come in that don't want to live in pain. The concern with pain medicines, and particularly over-the-counter medicines, it can inadvertently and accidentally cause risk factors for heart disease, for kidneys, for liver. And so if there's natural alternatives, I wanted you to be aware of those. Again, pineapple, papaya, cherries are considerations. Essential fatty acids with enzymes work really well long term. It takes about 3 to 4 days to kick in. So maybe an alternative is to use some ibuprofen for a day or two while you're adding the other natural stuff, and it'll not hurt your liver and your kidneys. So that's a quick review about ibuprofen. If you want additional information or handouts, please type #pain in the comment section, and please like my page or video. If you have a healthcare question, please leave it in the comment section so I can address it in a video or podcast. I'm Dr. Jason West. I'll see you on the next video.